2000 joined as an attending. His primary interests are taking care of patients with breast cancer, and that's what he focuses his area of research. He was the Associated Director of Multidisciplinary Breast Cancer Program from 2005 to 2013, and the director from 2013 to 16. He works with a talented group of professionals in our breast center team.
Thank you. For those who wants to do a perfect post-test, pay attention to some of the information here. All right. Breast cancer remains the most common cancer in women in the U.S. Lung cancer is the most common cause of death related to cancer in the U.S. It's about 230,000 cases of breast cancer every year. About 40,000 patients, unfortunately, still pass away from breast cancer. In the greater Jacksonville area, which we have about 1.4 million people, there is about 1,600 cases per year of breast cancer. The incidence in the state of Florida is about 114 per 100,000 people. It's missing a slide. That's okay. So before the 1990s, we used to treat all cancers the same way. Let me double check, yeah. No, somehow, there we go, that's fine. We used to treat all breast cancer the same way. We just said, well, it's maybe a ductal or a lobular, and the ones who are estrogen positive, we gotta get tamoxifen, and that was the only way we knew how to treat breast cancer. Until around 2001, when a group of investigators started doing genomic profiling in different types of breast cancer and found that probable breast cancer is at least 4 different groups of diseases, and classify this from the molecular subtypes into what we call HER2 positive, basal cell breast cancer, and luminal breast cancer that is divided in 2 groups, luminal A and luminal B. And if you look at, if we can also say that it goes pretty much from the most aggressive way, basal and HER2, to the least aggressive subtype of breast cancer, which will be the luminal A. And what that matters is if you look at the upper right side, the outcome of patients with breast cancer, depending on their genomic profiling, you can see that those patients with luminal A breast cancer, they do very well with 70, 80, or up to 90% patients cure. However, patients with the basal cell